student nurse. Today I'm going to be doing a head-to-toe assessment on you. It should only take a few minutes. I'm going to wash my hands and provide you privacy. Take a look at your wristband, please. Okay, so can you tell me your name and date of birth? Okay, perfect. Do you have any allergies to any medications, latex, or iodine? Okay, patient has no allergies. Can you tell me where you are? Can you tell me why you're here? Can you tell me what the date is? Okay, so patient is alert and oriented ×4. His speech is clear and it has a purpose. He doesn't seem to be in any distress. His breathing looks good. He doesn't seem to be in any obvious pain. He's acting his age, his behavior is appropriate, and his mental status seems adequate. Okay, so then I will move on to the vital signs. So I'm going to get the correct size cuff for his blood pressure. I'm going to take the patient's blood pressure. Patient's blood pressure is normal at 120/80. So while I'm here, I'm also going to auscultate the apical pulse so I can get his pulse rate. And I'm opting to do this over the radial pulse. So I'll be taking the patient's apical pulse for a total of 60 seconds, and while taking it, I'm also going to watch the patient's respiratory rate. Okay. Patient's pulse is within normal ranges at 60 to 100 beats per minute, and his respiratory rate is within normal ranges at 12 to 20 breaths per minute. So now I'm going to be taking his temperature. Put the probe cover on it. The patient's temperature is normal at 98.6. So after assessing the patient's vital signs, everything looks normal. So I'm going to go ahead and move on to the head. I would check the head for any lice or lacerations or any wounds on the hair. And then I'll be assessing the patient's eyes. So I assess the patient's eyes. Just by looking at them, I can tell that the sclera is white and there's no redness or jaundice. So I would ask the patient to open their eyes and look at the pen light. And I'm just going to assess for pupillary reaction to light, and as well as accommodation on the other eye that I'm not shining the light in. And I would do this for both of them. Okay, and then I'm going to ask the patient to look at the tip of my pen and follow it with only your eyes. And this is testing the cardinal field of vision. Okay, now I'm going to ask you to look at the tip of my pen and then look at something in the distance, and this is assessing for pupillary constriction and dilation. So then after doing this, I can tell that the patient's cranial nerves 2, 3, 4, and 6 are intact and functioning, and the patient's pupils are equal bilaterally and there's no abnormalities in them. So then I will move on to the nose. I will quickly assess the nasal mucosa, which looks pink and moist as it should. There's no nasal flaring, and then I can also hold each each nostril and ask the patient to breathe. Okay, now I'm going to be assessing the patient's mouth. What I can see from the lips, there's no signs of any cyanosis. The lips are pink and moist. So now I will ask the patient to open their mouth, stick out your tongue, and say ah. And as the patient's doing this, I can tell that there is a uveal rise, and the tongue comes out straight. The oral mucosa is pink and moist, and there's no signs of any wounds in the oral mucosa. Based on the patient's skin on his face, I can tell that everything looks normal. There's no signs of any lesions, lacerations, wounds, or bruises. So now I can continue on with the thorax. I will ask the patient if it's okay for me to expose his thorax. So I will do that. Based on inspection of the patient's thorax, everything looks normal. The skin is the appropriate color. There's no lesions, lacerations, bruises, or wounds, and there's also no surgical sites on the thorax. So I will continue to assess or auscultate the lung sounds, and I will assess the anterior as well as the lateral lung sounds. The lung sounds are clear and equal bilaterally, so I will continue on with the heart sounds. I will start with the aortic, pulmonic, tricuspid, herbs, and the mitral valve. And the heart sounds are normal, they're regular and steady. So everything looks good with the thorax, so then I can further move on to the abdomen. So I will ask if it's okay for me to expose the patient's abdomen. For the abdomen, I want to inspect, auscultate, and then palpate. So based on inspection, everything looks normal. The skin is the appropriate color. There's no lesions, lacerations, bruises, or wounds, or any surgical sites. So now I can continue on with auscultating. I will auscultate the 4 quadrants. There are active bowel sounds, and there's no signs of any bruise. So now I'll ask the patient, are you having any pain? The patient says that they're not having any abdominal pain, so I will continue on to palpating the 4 quadrants, as well as the epigastrium and the suprapubic area. And while I'm here, I'm going to ask the patient if they're having any pain overall on a scale of 0 to 10. The patient states having no pain, but if they were to say that they were having pain, then I would use the old cart method, which is onset, location, duration, characteristics, aggravating and alleviating factors, radiation, and treatment. So now, after assessing the abdomen, I'm going to take a quick look at the patient's arms. So just on inspection of the arms, everything looks normal. The skin is the appropriate color. There's no lesions, lacerations, bruises, or wounds. I'm going to feel for any heat. And there's no heat on the patient's arms. So then I'm going to check the capillary refill. So capillary refill returns within less than 3 seconds, and it returns to pink. I will ask the patient to grip my fingers, and I can tell that their grip strength is equal bilaterally. So then I will ask the patient to push up on my arms, push down on my arms. And so I can tell that the patient has active range of motion. I'm going to ask them to bend at their elbows, put their arms above their head, and bend their wrists. And patient has active range of motion in his upper extremities. Before I continue on, I'm going to ask the patient to raise his eyebrows, smile, and frown. So I can tell that cranial nerves 7, 9, and 12 are intact. So then I will move on to the lower extremities. So while moving on to the lower extremities, I'm going to take a quick look at the perineal area. Everything looks good. So I will cover the patient back up. So by looking at the legs, everything looks normal. The skin is the appropriate color. There's no signs of any lesions, lacerations, bruises, or wounds. I will feel for any heat. There's no heat. I will assess the calves for any redness, swelling, heat, or pain. I will also check for any edema. I'm also going to check the heels for any pressure sores or injuries. And then I will assess the patient's capillary refill on his toes. Capillary refill returns within less than 3 seconds and it returns to pink. So then I will move on to the dorsalis pedis pulses and I will feel them at the same time. So the dorsalis pedis pulses are equal bilaterally. I'm going to ask the patient to bend at his knees, move his ankles, and then push down on my hand, pull up. Okay, so patient has active range of motion and good strength in his lower extremities. So then I will ask the patient to roll on his side so I can assess his back. So based on his back, I can tell that the skin looks good. There's no, his sacral area as well as his scapula is good. There's no pressure injuries or bed sores. There's no wounds, lacerations, lesions, or bruises that I can see. His calves also look good as well as his heels. So now I will move on to auscultating the posterior lung sounds. Okay, I can tell that his posterior lung sounds are clear and equal bilaterally, so I'll have him get back down on his back. Okay, so then at this point, I would ask the patient to stand up and walk so I can assess his gait. And I'd be able to tell that his walking pattern is equal and he has good strength. So then I will help assist the patient back into the bed. I will cover them up. And then I will lower the bed so that they don't fall out. Set the bed alarm. And I would say thank you for allowing me to do your head to toe. And I'd wash my hands and leave.